Good afternoon. Good afternoon. You're welcome today to the Subcommittee on Insurance, Life, and Health. Appreciate you all being here. I'm going to call up our first presenter, and that will be Chairman Lumsden. Would you like to go to the podium?
There we go. Madam Chair, members of the committee, I am here today to present House Bill 1262. This legislation is brought at the request of the Department of Insurance, and it addresses the Insurance Commissioner's statutory authority. We're working from the House Bill 1262, LC 520959. As I said, this legislation is brought at the request of the Department of Insurance, and it addresses the Insurance Commissioner's statutory authority to levy fines against insurance companies that violate certain provisions of state law. Specifically, it applies to 4 areas: mental health parity enforcement, general fining authority, surprise billing violations, and prepaid legal service plans. Under the current law, the Commissioner may impose a fine of up to $2,000 for an unknowing violation and up to $5,000 for a knowing violation. However, those amounts have remained unchanged for decades. The $2,000 cap's not been adjusted in more than 15 years, and the $5,000 cap has not been updated in over 30 years. Now, while those penalties may once have represented a meaningful deterrent, inflation and market growth have significantly eroded the impact that those fines might have. In the interim, the General Assembly has enacted important consumer protection measures, including mental health parity requirements and surprise billing protections. Yet the underlying fine structure has not been modernized to reflect the seriousness of these obligations on the scale of today's insurance market. House Bill 1262 updates those penalties to ensure they serve as an effective enforcement tool rather than simply the cost of doing business. The bill increases the maximum fine for unknowing violations from $2,000 to $10,000 and for knowing violations from $5,000 to $25,000. This legislation does not create new violations or expand regulatory scope. It strengthens the Commissioner's ability to ensure compliance with existing law and to hold companies accountable when they knowingly and intentionally disregard their obligations. I have with me from the department Bryce Rawson, who is here and can answer any questions that you might have, but that is the bill in jest. It simply addresses the, upgrades the fines that the insurance commissioner may levy for those companies that do not abide by the laws.
Thank you for this presentation. Are there any questions from the committee? Is there anyone that from the audience that would like to address this? Please, if you would come to the podium, state your name and who you represent, please.
Thank you, Madam Chair, and thank you, Mr. Chair, for bringing this bill forward. Good afternoon. My name is Sarah Phillips. I'm the Associate Director for the Carter Center's Rosalind Carter Mental Health and Caregiver Program. I'm here today in support of this bill, which would strengthen Georgia's ability to hold insurers accountable when they violate mental health parity laws. The Carter Center has played a sustained and active role in advancing mental health parity in Georgia through advocacy, implementation, and education. Since 2018, alongside Georgians for a Healthy Future, we've led the Georgia Mental Health Parity Act, which brings together consumers, providers, advocates, employers, and state officials to identify systemic barriers. Earlier this month, we held our 3rd annual Mental Health Parity Day at the Capitol to ensure legislators hear directly from consumers and experts about how parity violations affect access to care across the state. And importantly, we have worked to support state agencies in the implementation and enforcement of Georgia's Mental Health Parity Act. We As the Carter Center applauded Commissioner King and the Georgia Department of Insurance for the recently announced $25 million in fines against insurers in violation of parity laws. These fines are significant, some of the largest I've ever seen. They validate what consumers and providers have long reported and send a clear message that mental health parity is the law in Georgia and it will be enforced. But at the same time, these enforcement actions reveal a really important reality, which is that noncompliance was widespread. And for many insurers, existing penalties were not enough to prevent violations in the first place. When fines are too low relative to an insurer's size or revenue, they risk being treated as a cost of doing business rather than a true deterrent. For consumers, the cost of parity violations are not theoretical. It's delayed or denied treatment, interrupted care, worsening mental health and substance use conditions. And for providers, parity violations mean administrative burden, inconsistent rules, and barriers to delivering care, even when services are clearly medically necessary. This bill builds on the strong foundation that Georgia has already established by ensuring that penalties are meaningfully enough to deter future violations. So again, we thank you for bringing this bill forward and urge your favorable support. Thank you.
Thank you for sharing this with us. We appreciate it. Are there any others that would like to make a comment? We don't see any. Since this is a hearing only, we will not be taking votes. I appreciate your presenting today. Thank you very much. Our next presenter will be for House Bill 1058, Representative Buckner.
Thank you, Madam Chair. I'll try to speak as loudly and as clearly as I can, but we do have a substitute, so the LC number is 443439S. And right now in Chapter 27, Title 33 of the Code, it reads that an employer-provided employee group life insurance policy cannot benefit the employer. And while that makes sense for the for-profit arena, it doesn't always make sense in the not-for-profit arena. In Georgia, there are roughly 57,000 registered charitable organizations. And when people work for them sometimes and they have access to this kind of policy, if something happens to them and they don't want to necessarily either they may not have anybody to leave it to or may not want to leave it to a family member but want to leave it to the organization, by law they can't do that. So what we hope to do with this piece of legislation is say that if it's a charitable nonprofit and they have signed the paperwork saying that they want to do that with their benefits, then they would be allowed to do it. I have with me Allison Evans. If you have questions of me, I'll be glad to, but she can probably explain what happened in her organization that might make it more understandable.
Thank you. If you would go to the podium and introduce yourself. Thank you.
Good afternoon, friends. My name is Allison Evans, and I'm the CEO of the Methodist Home for Children and Youth, which has been an organization here serving the children and families of Georgia for over 150 years. So we've got a lot of long-standing support here. Her dress was emerald green, and she bought it 10 months before she intended to wear it when she received her 10-year plaque for working with the Methodist home. And she worked in our foster care with our foster care kids. But unfortunately, 2 months after she bought that beautiful green dress, we ended up having to bury her in it. Her name was Stephanie Macon. She's 54 years old. She said she'd worked for us for nearly 10 years. It was a sudden, unexpected loss. And as things unfolded, we realized that she had left the Methodist home as the beneficiary of the life insurance policy that we provide for our employees. We were touched by that generosity. And when we reached out to the life insurance company, our claim was denied because we were the employer. And there's a Georgia statute that says that we could not be that beneficiary. We appealed that, citing a Virginia law case that had identical language, but we were again denied. Her secondary beneficiary was a church. And I'm a woman of faith, and I just want to share with you how God made things work out perfectly fine. When we found out that we were not the beneficiary, I went and spoke to the church. The church made the decision to receive the full benefit of her life insurance policy and then gave half of it back to the Methodist home. God had provided a donor in that time period who did a dollar for dollar match. And so literally with that half, we became whole again, and we were able to dedicate and use those funds in the program in which Stephanie served. It's just important that nonprofits, if someone chooses to share that with them, that they be able to receive that benefit. And while this may not benefit the Methodist home right now, and God took care of us, I do ask that you would consider inserting this language. It's a simple request. There's no fiduciary responsibility to the state. But would you please consider making this possible for all of the nonprofits here in the state of Georgia?
Thank you for that presentation. We do have a question. Chairman Gamble?
Thank you, Allison, for coming today and reaching out to us about this bill. I did have a couple of things I wanted just to clarify. So she had a guaranteed issue life policy that y'all offered to the employees there.
We offer them to all of our employees, yes, sir.
Okay. And it's also, isn't it true that our residential treatment programs like yours often struggle to supplement the funds they get from the state and the funds it actually costs to take care of the children that you take care of?
Absolutely. We receive, the funds from the state cover about 80% of what it costs to provide the care that we have, and the donors across the state of Georgia are so generous. And sometimes they give in an immediate way, they respond to an appeal, come to an event, but many include the children's home, the Methodist home in their will or their trust. And this person wanted to do the same. And there was an easy way to do that by signing over her life insurance policy as the benefits for that.
Mm-hmm. Yeah, thank you for bringing this, and I know we talk about rate increases for you guys all the time, and unfortunately we're not able to do it probably as often as I would like, but in this particular case, this would have really helped had we been able to access a benefit like this.
Absolutely, sir. Thank you.
Thank you.
Thank you. Are there any other questions from the committee? Anyone from the audience that would like to speak to the bill? Okay, please come forward. Introduce yourself. Thank you.
So I'm Bobby Potter on behalf of American Council of Life Insurers. And when I saw Representative Buckner's bill, I sent it up to them. They had asked for not even a sentence, a phrase for clarity about the donor naming the beneficiary. That was incorporated, which we appreciate. And as a good Methodist, I appreciate hearing this story, and we support the bill.
Thank you very much. Is there anyone else that would like to address it? I see none. Thank you very much for your presentation. We appreciate it. Thank you. Okay, our next will be Chairman Powell.
Thank you, Madam Chair and Committee. I bring to you today House Bill 961. I've just had a chance to look at the substitute as provided me, and it seems to be a lot of similarities to it. But I'm going to talk just a few points about what my intent was on this, and then, of course, I'm going to defer to the chair lady of the committee and the committee, since insurance isn't exactly my specialty. I don't have the privilege of being a good Methodist. I am a Southern Baptist sometimes, but I don't know that the Lord can sit on my shoulder on some of these insurance issues. I bring this bill to you because I had an incident that occurred. Someone that I was very close to had called for an ambulance service, an emergency. They didn't send a county ambulance. They sent a private ambulance service. Took him 10 miles, charged him $4,500. Absolutely outrageous. And in the conversations, and I had gotten a dear friend of mine who's awful good at negotiations. He talked to this private ambulance service, and they negotiated the fees down to about $2,500 or thereabouts. But in pursuant to conversation, he explained to me some of the issues on the reimbursement. And what we had originally intended to do, we put 3 cases into this in the original bill, and it was going to be the lower rate, and it would be if it was a contract established by the local government entity, the lowest in network fees, or I think I put 400% of the Medicaid rate. Now, that being said, that's what I can pass along. I don't think that's what all this is doing here. I know that the sticking point for our public ambulances has been the reimbursement rates, and I certainly understand that. You know, if we have any other than law enforcement, public safety, and I consider EMS services a public safety. You know, they're the ones that get us to a hospital, whether it's been a heart attack or an injury or an accident or anything else. But that's not a very inexpensive service that these public facilities are run by. Most everybody I know that the counties has to subsidize in their county budget. And I'm very familiar with county commissioners. They got a lot of things they want to do, but when they look at those fees, you know, sometimes they don't give them all they need. These ambulances, the cost of an ambulance, if you get on a waiting list for them, are outrageous amount of time to get them. And this, ladies and gentlemen, is just something to put it out there so that folks who call because they need assistance, they need to be assured that if they got insurance or something, that they're going to be able to get that service, because somebody that's in need, they don't have time to negotiate with the 911 caller or whoever they call to check to see if they can afford it or they're even eligible. And that, Madam Chairman, is what the intent was. And I'm going to stand back, and since this was drafted perhaps by you, and I understand that the number one issue is that reimbursement rate. And I noticed in this, I think I had started at 400. I think the Senate passed one at 325. I hear some have said 200 is, you know, above, and I see this says 300. And I will bow to the will of this committee, and hopefully you'll move this bill forward and help me struggle through it.
Thank you, Mr. Chairman. I agree with you. This is a difficult task, and in our investigation and reviewing it, depends on where the ambulance service, there's different rates depending on where the ambulance service is coming from, if you're in a rural community, in suburban or urban areas. We kind of split the difference. That's basically what we did. It's a good starting point. We're going to track this information and see if we need to address it further down the road. I think there is a companion-type bill in the Senate, but I'm with you. I want to get something done. I don't like the idea of people being stuck with a surprise bill, which is, I kind of wish this would have been attached to the surprise bill. But since billing is done so differently for ambulances, then it's not just one simple code. There's a lot of different things that are involved in it. So we met with Legislative Council to try to find a common ground. So I appreciate your working with all the members on this.
Well, I appreciate you, Madam Chair, and thank you so much.
All right, you're welcome. I do see Representative Scott, you have a question?
I have a comment, and thank you for bringing this bill, because I was transported from over in Buckhead to Atlanta Piedmont, and it was $1,800. And then they also charged me for gas also. So it definitely needs to be something done with the ambulance service, because that is a lot of money for the little miles that I went. And I think the gas, the amount was was tremendous for gas for about 10 miles.
Thank you very much. Is there anyone in the audience that would like to address this? Please come to the podium.
Yes, thank you, Madam Chair, members of the committee. My name is Jesse Wethington. I'm the president of the Georgia Association of Health Plans. We appreciate the opportunity to provide comment and make the committee aware of some of the concerns that we have with the approach taken out in the bill. I do appreciate the chair convening us with a sponsor and having a discussion later last week. Again, there is a Senate bill, as you mentioned, that's coming along as well, where the rate is a little higher. And for our members, really that numerical rate being fixed in the statute is the primary concern. As you all recall, in House Bill 888, which was the Surprise Billing and Consumer Protection Act that was adopted by this body several years ago, ground ambulance transportation was left out of that bill because it's a very thorny topic, and it's just the service, the way it's provisioned, the way it's delivered is just very different from the other aspects of care that were covered in that bill. Our concern with this is that if the percentage of Medicare is set too high, there is an incentive for the ambulance providers to not enter into contracts with health insurance carriers so that our members would not be able to take advantage of any negotiated savings for transports. As you've heard, they can be very expensive. Of course, there's a countervailing thought that if the rate is set too low, there would be the opposing incentive for us not to enter into contracts with them. So we understand there is a balance to be struck. We appreciate the author being willing to work with us and hear our concerns out. We're committed to working with both sides throughout the process, try to get to a mutually agreeable point that really takes the patient out of the middle. I think one of the good things about this bill is the prohibition on balanced billing, which does protect folks from kind of getting that sticker shock like you experienced. One additional concern that I raised in the Senate committee last week, and I've discussed this with the chair lady as well, is the wrinkle of a new regulation that's come out in Washington related to products that are sold on Georgia Access, formerly known as healthcare.gov, or the exchange. The 2027 Federal Notice of Benefit and Payment Parameters has established a rule where any state-passed mandate that's entered into the code after the date of December 31st, 2011, will no longer receive any kind of federal subsidy in terms of covering the cost of those mandates above what was defined as the minimum essential benefits floor as it existed on January 1, 2012. Therefore, mandates such as this would be covered by the state treasury at that point. It triggers a process called defrayal, whereby the state government that passed the mandate is on the hook for the cost of that extra benefit over and above, and that either has to be defrayed to the insurance carrier or to the insured for sort of what the actuarially calculated value of that additional benefit would be. So wanted to make sure that the committee was aware of that kind of beginning in 2027 and every year afterwards. Mandates that over and above that threshold would be subject to state appropriations to cover those costs. So for individuals on the exchange, this would be a concern. That would be, the cost of this would be met by the state treasury. That would leave those individuals who receive coverage from group health plans sort of having to bear any additional costs that came associated with this being set at that level of 300%. So we would request respectfully consideration of a lower amount, but again, commit to working with everybody through the process to get to something we can all live with.
Thank you very much. Are there any questions? Thank you for sharing your thoughts with us.
Thank you, Madam Chair.
Are there any others that would like to speak? Please go to the podium, introduce yourself.
Thank you, Madam Chair and Committee. My name is Chad Black, and I'm the Chairman of the Board for the Georgia EMS Association. And we come here today to reference House Bill 961, where, and thank Chairman Powell for bringing this, there is a lot of problems, and we have been kept out of surprise billing for obvious reasons, both federally and on the state level. But Chairman Hawkins has been telling us we have to go into surprise billing, and we understand that, but we've got to have something to offset that. It would be catastrophic. While we support Chairman Powell's bill, as you mentioned earlier, there was one in the Senate that the EMS profession supported that did pass 51-1 earlier today at 325% of Medicare allowable, which is, for the 16 states that has passed this, that is about 8 or 9 of those are at the 325, kind of a base level. There's a few higher and a few lower. 325 is where we have to be to make this feasible and work for us. As you mentioned, and Chairman Powell, a lot of the counties, it's 50-50. Reimbursement does not even, from insurance, Medicare, and Medicaid, does not even pay for preparedness and readiness for buying the ambulance, the equipment, salaries, benefits, housing, everything that goes with it, and it definitely doesn't pay when we actually run the call. So having this at 325 to be able to go into surprise billing, as the Senate bill, I believe, stipulates, would be a win for everyone. Now the balance bill, as you heard here, they send a balance bill to them. If they pay it, that's great. If they don't, it goes to collection agency, and then their credit is dinged. So that would alleviate that, and it would put us it wouldn't put us where we need to be, but much better than where we are today. The EMS profession, hospital, county government, and privates in Georgia totally support the 325% in both bills. We feel strongly that people pay their insurance premiums, and every insurance policy says it has ambulance transport in it, but yet when that happens, well over 90% is classified as out of network and we don't go in network because those rates are even sometimes as low as Medicare and Medicaid. But this would be good, and we feel the insurance company should pay it, not the patient. They're already paying their premiums, and they shouldn't have a balance bill, nor should the county government and taxpayers have to offset that as much as they do today. So we're in support of it, but at 325%, and I'll take any questions, but thank you for your time.
I don't see any questions. I appreciate your
Thank you.
sharing with us. Thank you. Is there anyone else? Please come.
Good afternoon, Madam Chair, members of the committee. My name is Joel Truss. I'm with Government Relations for the Association of County Commissioners of Georgia. We represent all 159 counties. We are proud to support this bill and thank Chairman Powell for his work on House Bill 961. This was one of our top priorities for our health policy agenda. And for all the reasons stated here that you've stated as well, this is something that we absolutely have to do. And just to address one major concern that was brought up by Mr. Wethington, on the temptation to just do out-of-network billing based on this bill, my members, or at least the ones I've talked to, are still looking at solutions for their county that will fit their unique needs. I don't know of any member right now that are expressly looking to stay out of network. So we're willing to work with the insurance providers as need be. But until that time, we do need to cover our citizens, and this would be a step in that direction. So I'm happy to take any questions, but other than that, I'm here at your disposal.
I don't see any questions. And again, thank you very much for sharing with us.
Yes, ma'am.
Please come to the podium and again, introduce yourself.
Chairman Taylor and members of the committee, my name is Les Schneider, and I'm here today in kind of a pro bono capacity because obviously I was aware of what happened, the reference that Representative Powell talked about, and of course hearing from the other representative what has happened. It's sort of like I never experienced a house fire, but when my house burned, after that I would run into 7 or 8 different people who would have house fires, and all of a sudden you realize what's going on. In the last few months, I've been really amazed at how many incidences there is of this surprise billing versus ambulance services. And I see there is a struggle between the ambulance services and the insurance industry, which of course is very well represented here today, as they always are. I guess I'm here today to think about all the constituents of all of you and what's going on in other states. As I think somebody testified to, there's 17 states that have tried to fix this and have actually done something about it. Of those 17, on this whole issue of what the right percentages is 10 of the 17 states do have 325% or higher. But there are other states like California, Delaware, Maryland, and New York that no rate is specified. And of course, I'm not a maven in this area, but my question is, why not? Why did they not put any rate in at all? And maybe that's something we need to look at. I listened to Senator Still in his testimony. I listened to the other people who testified on that bill. And I guess my question is simply this. There's a rate established by the local government that they negotiate for ambulance rates. There is this issue of what the right percentage of Medicare is supposed to be. But I have to ask the question, is that if certain ambulance services do have an in-network reimbursement rate, why, in a case of an emergency, would that rate not be part of what we would choose from? And should it be the lower of these 3? Now, I know some of the ambulance services object to that, but I think we have to take a hard look at, if I happen to have the insurance where I have the in-network charge, but Representative Gamble doesn't, and they're going to charge him out of network, and he's going to get a $4,000 bill, and I'm going to get a $1,000 bill, That's not the way you should treat emergencies and a 911 call. So I would hope that we would think about this bill and make sure that if it is truly an emergency and there is a problem here, then we try to use the lower of the three. And if an in-network rate is unsustainable, then maybe that says more about the insurance analysis here or what the ambulance services are doing. And I think there needs to be a little more thinking in that area. I realize 325 seems to be what everybody is banging the drum on. And if that's where it's going to be, that's fine. But at least that should give people who are in the middle of an emergency, they're not going to get sticker shock on this type of billing. And for somebody to get a $4,000 bill for going 11 miles, or like Representative Scott just talked about, is really, it is awful. And they got caught in a system that is really, has very little regard for the people who they're transporting. I do, I don't know if it's in the version of the one I just looked at, but yes, I think on lines 112 through 116, having the commissioner have the right to impose monetary penalties, a compliance plan or whatever, is certainly probably the balance that needs to be utilized. But at the end of the day, I am not quite understanding why we don't give the patient the benefit of the doubt in the case of a real emergency. And if someone contracts with a county for a service and is willing to give the in-network reimbursement for somebody on the policy, why would somebody else in an emergency situation not get the same? And if that's truly the lowest of the three, then maybe that's what we ought to be taking care of our citizens in that regard. So I think we're in the right direction. I don't think there's a big difference between Senator Steele's bill and the one that Representative Powell has put forward. But I do think this is the year that we need to be the 18th state that gets this directed. So I'll stand for any questions if there are any.
I don't see any questions. I
Okay.
appreciate your sharing with us.
Thank you.
I appreciate everyone that has brought forward information about this bill. This was definitely a well-thought-out bill. There's many aspects to it, and I appreciate everyone's input on it. When you walk away and not one person is totally happy with it, that means you've probably done something right. Everybody got a little something. I will tell you, I personally will be watching this and looking at data in the future to see how it's working out. Thank you. We're not taking votes. These will be taken up in full committee. We have one more bill to hear, and if you would, Representative Gullett.
Never could keep an audience. That's right. See y'all later. Thank you.
Please go right ahead.
All right. Thank you. This is House Bill 1198. It's LC 520996. And this is really a consumer convenience measure that updates Georgia's law to reflect how products are sold today. When someone buys something like eyeglasses, a smartwatch, a handbag, retailers will often offer an optional protection plan right there at checkout, the kind you protect your purchase for a few dollars that many of you are probably familiar with. Current law already allows insurance to be offered on portable electronics. This bill modernizes that definition and allows similar protection plans to be offered on certain consumer goods. It doesn't require anyone to buy coverage, simply allows retailers to offer at the point of sale, at the point of sale if a customer wants to add that protection through a limited license. Small practical update gives consumers more choice and keeps our statutes aligned with modern retail environment. Happy to answer any questions with that.
Does anyone on the committee have a question? I don't see any questions.
All right.
Anyone from the audience that would like to address this bill? I don't see any. Thank you very
Thank
much
you.
for bringing to it. We
Sure.
appreciate it very much.
All right.
That concludes our business, and we are adjourned.